Greetings from Citizen Health Team under Academia IAPSM. Very warm welcome to you, sir. We have Dr. Pradeep Kumar, sir, today for our series. As we all know that we have initiated a series, People's Health It Matters. He's an MBBS MD, a professor of community medicine at Dr. M.K. Shah Medical College, Ahmedabad.
Thank you, Ritu, for such a beautiful introduction. Thank you.
Thank you, sir. And I would like to tell everyone that we are going to talk on a very important topic today, that is population growth. As we all know, we all are concerned about the population growth nowadays. This is the dilemma in everyone's mind that should we have a child, a two child, three child, four child, how many child should we have? And nowadays, now government have taken the initiatives for the making laws for the population growth. So today we are going to talk on the population growth, right, sir?
Sure.
And let me start the session without any more delay. Sir, I would like to ask that what has been the global scenario of population growth and what has been its impact?
Population growth has been a global phenomenon and it has been observed since, I should say, 18th century onward, world over. And there are certain problems associated with the population explosion. It outstrips your environmental resources. It leads to a social inequity because resources are overutilized, and that problem is there. Now, I will take you back to, say, 18th century. There was a British economist, Thomas Malthus. He's a famous person. He was an economist. He was also a demographer. He gave a theory of his own, Malthus theory. There he said that for any situation, the population growth is exponential, whereas food supply growth is mathematical or arithmetical, simple arithmetical. So there is a time comes. So when this population growth will overtake the food supply growth, and that will create a very catastrophic, disastrous situation. And he also further said that if there is a more food supply is available, then population growth will increase. So there will always be a gap, nutritional gap or food gap, and that will lead to the disastrous situation. That is how the beginning of this thought came into the mind of the people. And then he also said that there are certain natural checks, for example, famine or war. They will take care of the excess population. That is how things can be brought down. Now, his theory was not perfectly correct because with over time period, it was found that it is not exactly fully correct. It is still true for the developing countries, but for the developed country, it is not so. And that happened because of we had a green revolution. It was a global phenomenon world over. So excess food production was there, and that didn't lead to the higher fertility or excess population growth. And similarly, there was a demographic change in the pattern of the people thinking. For example, delayed age at marriage. People took a conscious decision that we should have fewer children. So because of that, this thing happened. But otherwise, I say that population growth, by and large, we all know that it's a demerit, it's a problem because resources are limited and population is more. So naturally, it's a burden on the resources. And then what happens, this population growth is not uniform. It is more in the developing countries like ours than the developed countries. So developed countries with more resources, they have to deal with a smaller population, and developing countries with the limited resources have to deal with a larger population that lead to the social inequity. Poorer are more poorer, they get less opportunities. Rich people, they get more opportunities. So that gap is also there, and that keeps on increasing. That is all about I can say, for this population growth which has happened.
So seeing current scenario of population growth with reference to our country and any need to do any mid-time correction in our population control program?
Population, as I mentioned, that this population control policy, India was actually the first country in the world which officially launched a program. So our, I should say, forefathers at the time of independence, they thought of this problem where it was not in the mind of the people. There was a lot of resistance also at that point of time. But India was the first country in the world to officially launch a program of family control, population control, somewhere in 52, 53. We started with that. Initially, it was an approach through the clinics. Just contraceptive devices should be made available to the people who want, and this was largely restricted to the urban areas. Then it expanded and became the part of the national health system, very intricate part of the system. Now, what I would say that there was a global phenomenon of population growth which was very severe. Let me say in 60s, 70s, and 80s. During that period, there was a huge population growth, and India was no exception to that. But then what happened? Certain measures, of course, the credit goes partly to the national program, which was run, and partly to the other demographic changes, or I should say socio-economic changes that brought down the fertility. The population started stabilizing. It's not stabilizing actually, but it's going towards intending to stabilize, going in that direction. So as of now, if you ask me, I will say that population is going in a direction where it is heading towards a stabilization. So that's it. I would say about that. And if you look at the demographic trend, we have in a situation which we call as a stage 4. Now, what is stage 4 actually? Stage 4 is, see, if you look at the population growth, it is an end product of birth rate and death rate. So what is the result of the birth and death? That is your growth. If there are more death than birth, then it is a negative, which is least likely to happen. Most commonly, it is a births are more, deaths are less. So there is some growth in the population. India is in the 4th stage where your death rate has almost become stabilized. It is 6 to 7 per thousand population per year. Every year out of 1,000, 6 to 7 people die. And there's no change can take place further. Further reduction is very difficult because in the most developed countries also the death rates are around that figure only. What we are experiencing is a slow and steady decline in the birth rate. Birth rate is coming down, but still it is around 20, I should say, 20 per thousand per year. When I was a student, it was, I should say, it was 30, 32 per thousand. So there is a constant decline. But still the birth rate is more than the death rate and will remain so for a very long time. So there will be some growth will always be there. But the growth rate has declined. If you ask me if I can quote from the number, I would like to give through the numbers actually. We do undertake this census every 10 years. Census done every 10 years. So between the two census, we try to work out the growth rate on what the population growth rate has been there. In 60s, 70s, it was 24.8 and 24.6%. So that means over a period of 10 years, if it is 100 people, we'll end up with 124 or 125. That was a period in the 61, 71 to 81. Then it came down to 23.8% between 1981 to 91. It came down to 21.54 in 91 to 2001. And in the last census, between 2001 to 2011, this was 17.64. So what I want to highlight over here is that population is following a declining trend. Earlier, the decline used to be between two census was 1% or 1.5%. Now, this time it has been 3 to 4% decline has been there. Unfortunately, we have not been able to undertake the 2021 census because of corona and other factors. It will be undertaken soon, and then we will get the true figures of this census. So my assumption is that we will see even the bigger decline this time. So it is, see, demography is like a train. If you put a brake today, it will stop. It will go stand still after some time distance. Same way, if you start it today, it will get its full speed after some distance. Same way it happens. So the demography is on the declining trend. Things are going in that direction. Only thing we can increase the pace of that decline. So we expect this is to be more. The second other component of the population growth is to understand is the young population. Because young population contribute to the further fertility and increasing population. So it was, I should say, proportion of 0 to 6 year population was 15.9% between 1991 to 2001. 91 to 2001, it was 15.6%. It has come down to 13.2% from 2001 to 2011. Because if young population is decreasing proportionately, then obviously these people will grow adult and they will contribute to the fertility, so population is going to decrease. Another thing is absolute increase in the population. As I said, the growth rate is still there. It is not negative, it is positive. So population is increasing, but as I mentioned that it is continuously decreasing. Population is decreasing, growth rate is decreasing. But at the same time, for the first time in 2011, the increase in between 2001 to 11 was less than the increase between 91 to 2001. So absolute increase was less than by 1 million. It was 18.2 crore, and then in 1 to 11 it was 18.1 crore. Now this is important because it is like जैसे ब्याज की बात करते हैं ना, मूलधन पे ब्याज जोड़ते हैं.
Hmm.
In 91 our population was less. Taking that as a baseline population, applying that growth rate, our population growth was 18.2 crore. And in 2001, we started with a bigger population, but still the absolute growth was only 18.1 crore. So that is a very healthy trend. It shows the future trend that population is on that mode. It is going to decline. So our current strategies are working well in that direction.
So
So there is
it means
no need to. Sure.
it means we are going in a right direction
We are going in the right
in
direction.
our
Only thing, pace can be increased or decreased. So there are
how
certain
will
efforts needed.
hmm.
Yeah. Again, there are two things, carrot and stick everywhere. It works like that
Hmm.
only.
Hmm.
So whether it should be more carrot or more stick or both. My,
Sir,
yeah, please.
please elaborate this. What is carrot and what is a stick?
Oh, incentive and disincentive, I should say. The people who opt for a small family norms, consciously take a
Okay.
decision to have fewer children, they should be
Okay.
incentivized, they should be rewarded. That is
Okay.
carrot. The stick means when
Okay.
you punish those people who have got more children,
Oh.
discourage them, punish them in a way that they don't go for the additional children. That is another way of doing
Mm-hmm.
it.
Right, right, right.
These
So,
are
in
short
your
term
opinion,
measures.
mm-hmm.
These
In,
incentive and disincentives are short-term measures. And my suggestion
mm-hmm.
is that demographic change is a long-term process. If I do today something, the result will
Mm-hmm.
come next 15, 20, 30 years. That is how things should
Mm-hmm.
happen and happen. But if I go
Mm-hmm.
for a short-term measures,
Mm-hmm.
I may get initially some very impressive results, but long-term there are certain problems also associated with that. That is what I would say.
Right, right. So, in your opinion, sir, what works better, carrot or stick, or mixture of both? Can you comment upon the changes proposed in population control strategies by states, such restricting certain benefits to large-sized
Mm,
family or to third child in the family?
yeah. Well, if you ask my opinion, it is the carrots or what you say incentive, they work better. They work better.
Hmm.
Because short if I mean people can recall what happened during the emergency.
Hmm.
There was a
Right,
forceful male sterilization done, and that was a time
right,
when
right.
really population control was drastically required,
Mm-hmm.
but it boomeranged, it failed very badly, so much so the
Hmm.
government had to pay very heavily for that.
Hmm.
That time government, Mrs. Indira Gandhi government, was removed,
Right,
and the
right.
entire emergency was on one side, and this forceful male sterilization became the biggest issue in the election. So this
Hmm.
thing doesn't work. And mostly this forceful sterilization is like locking a stable when horse is already out. When you sterilize, use
Right.
the permanent methods for
Hmm.
females or for males. Mostly the people
Hmm.
come when they have already completed their fertility, when they have already done the damage by doing having three,
Hmm.
four, five children, whatever their number want to have, and
Right.
just menopausal women they come and get this operated. So that is how the things work with this thing. Now, the current policy where government is saying that let us give some disincentives to the people who go for the more children. Now, norm they take it as a two children.
Hmm.
Now, here I differ with the majority people what they say. According to me, this will not work in a long run. Only today I say itself, I have come across a newspaper item in my Times of India, where local municipal corporation of my city, that is Ahmedabad, they have decided they will not provide delivery facilities free of cost to those people who come for the third child. It sounds very, apparently it sounds very interesting, very attractive. People, as if people will not stop conceiving because they will not get free delivery facility for the child, but it doesn't happen. Really, in real life, it doesn't happen like that. It simply will not happen. What will happen at the end of that? Who come to the government hospital for free delivery? Poor, less educated, slum dwellers, migrants. Now, these are the vulnerable people. And believe it, they will not stop planning third child or fourth or fifth or sixth child, whatever it is, just for this reason that their delivery will not be free of cost. Number one, government will not have a mechanism to find out whether it is really third child or second child. because you have to spend a lot of resources. You have to have a whole system to find out whether it is really second child or third or fourth. After that, you will not give that facility, or you will charge for that. So what will happen? People will either they have to pay for that delivery. I'm taking an example of delivery. It will go on for many other schemes also. Either they have to pay for that delivery, or they will go for home delivery, which is much more dangerous. So this will increase the gaps. Now, sometimes they say that the people who have got two or more than two children should not be allowed to contest the elections. Now, this lead to a lot of spurious things and practices. People will give their third child as adoption to somebody. So they say that we have got only two children. Some people, polygamy people, have got two wives, and so I don't know how they will count the children for the female partner, two children per female partner, or two children for the male partner who is contesting the election. If female is contesting, I mean, so this whole thing is very jumbled up. The only thing, it will take away the opportunity. Similarly, people may be knowing that ICDS, Anganwadi scheme, which provides supplementary food to the children and the pregnant lactating women. Now, if you take away this facility from those children who are third or fourth in the family, or this Ayushman Bharat, where the insurance, health insurance is provided, you take away that facility from third and fourth child, what will happen? Number one, the delivery has been a home delivery. So there are a lot of chances of neonatal mortality or infant mortality. If the child is again deprived of the Anganwadi or ICDS system, child will not get the supplementary feed. So will suffer from the malnutrition or undernutrition. Schooling, right to education, where the poor children, poor children are getting admission to the good schools. There's a certain proportion is kept for that. If you take away that facility, children will not get the study opportunity to study in the good schools. So at the end, what will you have? You will have high child mortality, high morbidity, undernutrition, deprivation of education, good education, good schooling, job opportunities will also not be there. So as a result of all this thing, what will happen? That children will be deprived. They will be there. The only thing, the gap between those who are well-to-do families and those who are poor families will further increase. That is my answer. Now you will ask what to do in that case, how things should work. My point is, if you look at the data of the entire country, there are southern states, there are northern states. Now, one thing I will go before further, I will try to explain to you what is this TFR, or total fertility rate. Total fertility rate, or TFR, in short we call it, is a proxy indicator of the fertility. What is that? It is a number of children a woman is likely to have in her entire span of childbearing age, which is 15 to 49. Earlier it used to be 15 to 45 years of age. But now menopause has been delayed now, so it is 15 to 49 years of age. A woman is likely to have the number of children during that entire period. Now, if that number is 2.1, we call it replacement fertility level. That means population will be stabilized. As soon as we achieve that level of 2.1, we will say, yes, it is population has been stabilized. It will neither decrease nor increase, because decreasing population is even more dangerous. That I will take up, if the time permits, I will take up that issue also, how declining population is dangerous. 2.1, because husband wife make two. Now together they will have two children, so that means they are being replaced by the two children. Some women, some male may not marry at all, and some children may die very prematurely, not to reach to that age where they marry and they further give birth to the next children. So 2.1 is considered to be optimum. That is the number. If you look at it, this TFR, it is very interesting to know southern states as a whole, they have got lower TFR than the TFR of the northern or central India. Irrespective of, I will say very strongly, religion, caste, poverty. So what is important? Something is happening in the southern states, especially Kerala. If you take Kerala and Goa, the states which have got the statistics, which is at par with the most developed countries in the world. And we recurringly conduct this NFHS survey. Other surveys are also done, which give us this figure very accurately. So the most important thing is there is something which is happening in the southern states, and that I will say socio-economic development. There are certain social development, there are economic developments, and together there is a very old saying that development is the best contraceptive. Rather than using any other method of contraception, development takes care of it. Developed countries, simply because they have undertaken the social and economic development, because they go hand in hand. Because what happens if educational opportunities are made available to everybody? Number one, job opportunities are made available to everyone. So first thing happens is, especially in case of female, if females they get educational and job opportunities, their marriage is delayed. The marriage is delayed, then their fertility is delayed. Because what happened? Fertility is highest in the age group of, let us say, 17 to 24, 25 years of age. If marriage is delayed by 5 years, the biggest fertility regulation is this. If marriage are delayed, and if the woman is obviously if she is studying, the marriage will be delayed. My own daughter, she has done MD medicine, general medicine. Recently, she got married after completing 30. Because she was busy in the studies of, neither she nor us could think of it. That is how things happen. And then, because husband and wife both are working, then they will again plan the pregnancy. So it will be again further delayed. So delayed fertility is as good as reduced fertility. That is how things work. In Kerala, if you look, everybody is educated, everybody is doing some job. So it takes care of that. And again, I repeat, I've got statistics to compare, because what happens, there are a lot of political connotations. I've got, for example, TFR. I've got the data with me. If you take up the couples where the female is simply not educated, illiterate, then the TFR is 3.6. That means she, along with her husband, will have 3.6 children in her entire lifetime. Those who have got education up to 5 years, I am taking in the number of years of schooling. So if she has been in school for 5 years, TFR comes down to 2.5. If it is up to 5 to 7 years, remains the same, 2.5 years. 8 to 9 years, 2.2. 10 to 11 years, 2.1. 12 years and above, that means those who have passed 12th standard and above. In those women case, it is 1.8. That means declining, less than 2. So this shows that education makes a difference. Education itself, number one, it will delay the marriage. Second thing, the woman will एजुकेशन पढ़ाई करके कुछ काम ही करेगी ना, कोई जॉब करेगी, मजदूरी तो नहीं करेगी, कचरा पोता दूसरे के घर में जाके नहीं करेगी. She will do some responsible job. So she has got the power to take decision. She becomes important from that point of view. She can decide. She will, rather than mother-in-law or husband decide, she will also be important stakeholder to decide how many children and when I should have the child, etc. So that is how this education works. Education goes along with the service. Good education means good service. Together, it's a development, and then financial things also improve.
So
That is what. Please.
One question is coming in my mind, that if we give a stick for this rule, like if we punish those people who have 3 child or more than 2 child, or more than 1 child, don't you think that it will increase rate of abortion also, and more than because one of my interviews, a very respected doctor have said that the second child is 90%, the second child is unplanned. So it may possible that the third one is the unplanned one, or in any case, don't you think that it will increase the case of abortions also?
It will, of course it should, because if you make a very strong legal policy that you cannot have more than 2 children, so obviously, see, contraceptives are not used so well in this country. Lady will conceive, and then they have to go for abortion. Abortion has got its own built-in risk. Now, the second thing, at the same time, you raised a very good point actually. In our country, unfortunately, I will say, there is a universal preference for a male child. Right? A family is not supposed to be complete till you have got a male child in the family. It happens with a lot of people, and this is not restricted to the poor people. Poor people will accept even girl child also very happily. But upper social class, male child is a must. So what happens if the first child is a male? They may stop. Okay, we wanted a male child, we have got, so we can stop. But if the first child is a female, then they will keep on trying till they get a male child. So that thing will happen. So it is very difficult, and a lot of other illegal, immoral things will start happening. Because in China, they tried this one child norm and it failed miserably. Now they are encouraging people, and people, by this time, as you said, as I told you, that demography changes take place in a long period of time. Now people in the habit of one child. So even China is encouraging, giving incentive to the people to have more than one child. People say no, we are happy with one child only, and they don't have this male-female preference to the extent that we have in our country. So that's right actually. Abortion will increase the abortion. Something is not very good because it has got all
Hmm.
built-in risk with that. That will happen, and plus
Hmm.
there are a lot of things will happen. As I mentioned you that they will give child in adoption to somebody. That thing happen. What I want to make here, the country is progressively having better education.
True.
I mean, literacy rate is improving,
Right.
and this TFR, as I mentioned you, there are several NFHS, National Family Health Surveys have been done. NFHS 1, 2, and 3. There has been a progressive decrease in the TFR. It is coming down, and it is expected that by 2045 or 2050, we will have population as stabilized. And see, after stabilization, it will not stop there. फिर आगे बढ़ जाएगी. It may go to the negative. Declining population may also happen. That
The
problem lot of European countries are facing nowadays.
so
Don't you think
that
why this Canada and Australia are encouraging people to come? Why they are allowing migration? Because their own population is
is very less. Right.
declining, and they are mostly elderly people who have to be supported by the state. So they need young, fit people. So that's why they are encouraging migration also. So that situation may come.
Hmm.
So
Hmm.
my point is that we don't have to go for this coercive measures where you do. I mean, incentivizing people who are opting for family planning or population control is a good thing, but
Hmm.
disincentives may give a different connotation, may give a problem to us, and then you will have more social inequity. Poverty alleviation can be achieved simply by having fewer children. That can also work in that direction, but that has to come with the education, occupation, economic development, and then social development. Everything goes together. Nothing happens in isolation. Health also will improve. Productivity will also improve.
Hmm.
So that is what I would
Okay.
say.
So in the last of this session, finally, I just wanted to ask you that is there any brighter side of the population increase, or is it all bad?
One thing I always say in this world, nothing is black or white. Everything is gray. And this applies to demography and economy also, right? A glass half filled of water is a half filled and half empty also. That is what people say. So to say that everything is bad with the population increase is not something good. You have to talk to the people who are from the Eastern European countries, where population is on decline. They are desperately worried for the declining population. Because what happened now, you are having more elderly people who are not productive, useful to the society, but you have to spend a lot on that. So they've got heavy taxation. People work day night, enjoy only on the weekend, and they pay huge taxes to support that elderly population, which is no more productive. There's a one thing. Now, India had a population explosion, 60s, 70s, continued till now. Now the growth has come down considerably. But thanks to that population explosion, we had a thing which is called demographic dividend. That means you had a younger population. In demography, we use the word dependency ratio. The people below 15 years of age and those above 65 years of age, they are to be supported by the population in the middle. So we have got a lot of young population. Now, what is the advantage of young population? Labor becomes cheap, handy. China had this demographic dividend. As a result of that, plus they had a very not pro-labor rules policy, so they could produce a lot of goods with a cheap labor, and they thronged the entire market, world global market. So democrat now what happened? People in our country, Kerala, take the example of Kerala. Nurses they from Kerala, even doctors, they work all over the world. Human resources are exported. It's not something very bad. Surplus human resources are exported. America, NASA, you have got plenty of Indian. UK health services dominantly run by Indians. So these people, when they go there, but their roots remain connected to us. So they send money to us. Now I say that repatriation of money by these NRIs, non-resident Indians, plus PIO, people of Indian origin, though they have become citizen over there, is the biggest source of earning to our India. So that is a good economy where if you've got surplus human resources, their export can also contribute to your economy. And I was saying actually that as I asked a very right question, that population increase is not that bad. It comes very handy for politicians to blame something for which they cannot be held responsible. Population ज़्यादा हम क्या करें? There are countries which have used this increased population. They have made a good use of that. And people will not say that your people in India, surplus population is working in the Middle East and sending a lot of petrodollars to this country, contributing to our economy. There is also a thing there. So point is that it is not that bad. And the demographic dividend which I was just talking about, China had it and they had it best. Now it is India's time. We are having, and this is something which is not permanent. Because if we enforce population control, that we have to do, no doubt about that. So this dividend will keep on decreasing and one day it will disappear totally. Because elderly population in our country is also increasing. At my time when I was studying, I don't remember the exact number right now, it was 6%, now it is 10 to 11%. Elderly population. Elderly population mean just burden on the society. You have to spend money on that, you have to upkeep them on medical services. This is very, because old people sometimes they are not productive to the society, number one. Number two, they suffer with the chronic degenerative diseases which have got no solution. If you increase the life expectancy, these people will live longer with those diseases on. So it's a huge burden on medical. So that way, this demographic dividend that we are having as a result of population growth will not last forever. It will go down. We have to make best use of this. So that is what I will say. So it has not been that bad. It has contributed also a lot. And once the thought process start, it automatically start coming down. And then you, even if you try, you cannot increase it further. So only thing government should support that thinking, should provide educational job opportunities, especially to the female. So they become important stakeholder and decision taker in their own families about the number of children and when to have child, how many children to have, then things will be better. That's all I can say.
Thank you so much, sir. That was a very informative and very interesting conversation today with you. And the most interesting sentence I got from you that education is the best contraceptive.
No, it is development.
So
Development is the best. But that has got education is a part
development
of
is
that.
the best
And you are right in
part of
saying
that.
education is also. Because if a लड़की पढ़ रही है तो वो शादी कहाँ से करेगी? तो शादी नहीं करेगी तो बच्चे कहाँ से होंगे? तो अपने आप डिले हो जाता है. अगर हर लड़की ग्रेजुएशन करेगी तो मैरिज एज अपने आप ही बढ़ जाएगी ना. उतने टाइम तक तो शादी वैसे ही नहीं होगी उसकी. So that's really, you are right. You got the essence of it. Thank you, Ritu, for giving me opportunity. I enjoyed talking with you.
Thank you so much, sir.
My
Thank
pleasure.
you so much.
Sure. Okay.
Bye.